y'all, welcome back. I'm Sara, a certified EMDR therapist and EMDRIA-approved consultant in training. And this is Club 07 Clear. If you're new here, be sure to go ahead and subscribe. Today we're talking about EMDR and four of the most common misunderstandings that I see both online and within clinical conversations. Things like, isn't EMDR just CBT? Are the eye movements a gimmick? Is it the best trauma treatment? Or even, is it evidence-based at all? So let's slow down, break it apart, and get into what the research actually says.
1, 2, 3, 4.
One of the most common things that I hear is that EMDR is basically CBT with fancy eye movements. I get why people say that, because both EMDR and CBT involve thoughts, beliefs, and symptom reduction. On the surface, they can look pretty similar, but when you go back to the original theories behind each approach, they actually come from really different starting points. CBT, developed by Aaron Beck, is built on the idea that distress is strongly influenced on how we interpret experiences. Our automatic thoughts and our core beliefs shape how we feel and behave. A lot of CBT work focuses on identifying and restructuring those cognitions as a primary pathway to change. EMDR, developed by Francine Shapiro, came from a different observation. Shapiro noticed that traumatic memories can stay kind of stuck in a raw, unprocessed form. So when they get triggered, the person re-experiences those emotions or body sensations or beliefs as if the original event was still happening. From this, Dr. Shapiro proposed the Adaptive Information Processing Model, or the AIP model. And it is important to name this clearly. AIP is a theoretical model, not a fully empirically verified neurobiological explanation. It's a guiding framework for how EMDR conceptualizes change, rather than a proven mechanism in the strict scientific sense. So instead of starting with changing the belief directly, EMDR starts by activating the memory network and helping the brain reprocess so that it can integrate into a more adaptive way. Now, EMDR does absolutely involve cognition. It is not like thoughts are completely ignored. Throughout the phases of reprocessing, we intentionally work with both negative and positive cognitions. And in phase 5, installation, we focus on connecting that trauma memory that once was disturbing to a new, more adaptive cognition, a positive cognition. Cognition is very much a part of the process, but the difference is where cognition sits in the overall model. And that's exactly why the next misconception shows up so often. Because people, whether it's people on social media or even EMDR therapists ourselves, focus so much on the eye movements, that is what the whole therapy becomes all about. And it is always important to question research and continue to understand the mechanisms of change behind therapeutic approaches. And to be really honest with you, the research here is kind of mixed. Some studies show clear effects of bilateral stimulation, reducing the vividness and the emotional intensity behind trauma memories. And others suggest that the picture is far more complex. So it leaves us with a real clinical question. Would EMDR still work without eye movements? One of the original theories behind EMDR's effectiveness was the REM sleep hypothesis, which suggests that the eye movements used in EMDR mimics the eye movements that occur during REM sleep, which is an important phase in our sleep where a lot of memory reconsolidation happens. This theory is still widely debated and not considered a full explanation on its own. More current research has shifted us to the working memory taxation model. When you hold a traumatic memory in mind while simultaneously engaging your working memory, doing things like following a ball moving or tapping your feet, it reduces the vividness and emotional intensity of that memory. And some studies do suggest that eye movements help reduce just that, the vividness and emotional intensity of memories. Other studies suggest that this effect is more nuanced, that bilateral stimulation is not like the main active ingredient. So when we zoom out, the takeaway is not that eye movements are a complete gimmick. They are part of a clinically effective process that clearly impacts how trauma memories are experienced and stored, but we are still refining our understanding of why that actually is. And that tension, that space between what we see clinically, these amazing therapeutic outcomes, and what we can fully explain, actually where a lot of good psychotherapy research lives. And I'm so here for it. Like, I can't wait to better understand why eye movements or any form of BLS is helpful in the EMDR process. If we set aside some of that tension, that leads us to ask, how does EMDR compare to other trauma therapies? This comes up a lot, and I am highly biased. I have an entire YouTube channel on EMDR, but when I hear people online say that EMDR is the best and only treatment for trauma, it upsets me in a real way, because I know that that is empirically false, that we have research that contradicts that. And so that is what I want to get into now. We look at research overall and compare EMDR, TFCBT, cognitive processing therapy, and even prolonged exposure therapy. All of these forms of therapy show really strong outcomes for PTSD. Across multiple meta-analyses, they show consistently reduce symptoms and show meaningful change. So in terms of effectiveness, there is not one clear winner that consistently outperforms the other. There is no car winning this race. Research shows us that they are all pretty effective. EMDR sometimes has been shown to have slightly less client dropout and to make change happen slightly quicker. Truly, the most important piece here is going to be like what the client prefers. We have to consider what feels accessible, tolerable, and aligned for one person might not for the other. And that can absolutely influence outcome and client engagement. Last and final piece of misinformation that I see all over social media and the online sphere, that EMDR is strictly pseudoscience. Let's start by defining pseudoscience, because words actually really do matter here. Pseudoscience refers to treatments that lack evidence, that are not supported by research, or are known to be ineffective or harmful. EMDR does not fit into that category. It has decades of research behind it, including randomized control studies and multiple meta-analyses supporting its effectiveness for PTSD. Across literature, EMDR shows meaningful symptom reduction, often comparable to other first-line trauma treatments discussed above. Now, does that mean that we know everything about it? No. We just had that whole conversation about eye movements and us needing to know so much more. But that's not unique to EMDR. A lot of effective treatments in the mental health field don't have one single clear mechanism for change. We do know this. EMDR helps reduce trauma symptoms, improves functioning, and is considered an evidence-based treatment in many major clinical guidelines. So when people label EMDR as pseudoscientific, that's really not aligned with the research. A more accurate statement is that we're still refining our understanding of the mechanisms. The clinical outcomes are consistently supported. We're trying to figure out the exact reason why they are effective, but we know that they are effective. Oh my goodness. Okay, so when we step back and look at all four of these misconceptions, CBT comparisons, the eye movement debate, effectiveness debate, and the idea that EMDR is just pseudoscience, really comes down to one thing: EMDR is often misunderstood when we try to reduce it down to one single mechanism or a single explanation. And while we don't have the answer to every question about how all of the pieces of it fit together, we do have consistent evidence that it helps reduce emotional intensity and vividness of trauma memories. I hope with this video is not to convince you that EMDR is perfect or that it's fully understood. It's to give a more grounded, clinically accurate picture of what it actually is. If you found this video helpful, be sure to hit subscribe and I'll see you the next time. Bye y'all.